So I chose to do my study on whether or not the use of methamphetamines while pregnant is going to have an effect on the child's physical and cognitive development. So this problem is significant because a recent study has found that 1.38 million women in the childbearing age range, which is usually about 15 to 40, have reported using meth in the last month, and the number just seems to keep growing. And there's been thousands of studies on what the effects of meth are on the person abusing it, but there's been very little research on what it can do to a developing fetus. So some background, studies have found that long-term use of meth can cause changes in the dopamine system that can lead to things like impaired motor skills, cognitive decline, anxiety, psychotic disorders, violent behavior, hallucinations, depression, and the list goes on and on. It's also been found recently that meth crosses the placental barrier easily. This is how the mother and baby exchange nutrients, hormones, things like that. So if it's crossing that barrier, it is in fact getting to the fetus. Meth-exposed children have also been found to have a lower birth weight, so they've been born lighter most of the time earlier as well. And then weight and height have been decreased significantly throughout development. So a child at 10 years of age exposed to meth is going to be shorter and weigh less than somebody who has not been exposed to meth as a fetus. So some gaps in the research. Since this study is extremely unethical to perform in a laboratory setting, most of these studies have been cross-sectional. They find a group of children who have been exposed to meth as a fetus, and they do a survey or questionnaires at that one point in time. And the follow-up is usually really short when there is follow-up. There usually is not. It's very hard to get these people to continuously show up to appointments for a long period of time. This is because meth is usually... People who are abusing meth usually don't have a very good income. They're usually low-income class, might not have a house, might not have reliable transportation, so it's hard to get them to keep showing up long-term. And these studies have also only studied children at different ages. They don't pick one age group and then follow them. They pick a bunch of different kids from a bunch of different age ranges, and that can have a little bit of an effect on results as well. So the purpose of my study is to examine the long-term effects that prenatal meth exposure can have on cognitive and physical development. The first aim of my study is to examine the height and weight from birth to adulthood in exposed children, so I'd like to follow them and get these measures from the time they are born to the time they turn 15. My second aim is to examine cognitive milestones throughout development and compare those to controls. So this is things like when they start walking, when they start talking, things like that. Some limitations to the study is that the meth exposure will be self-reported. It's not something that I can measure. The cognitive and behavioral problems will be based off of a scale, and that will be reported from parents. That could be biased. That could very much lead to some bias. And then it's always the case that some participants might drop out. I can't ensure that all of my participants will stay throughout the entirety of the study, especially since it's such a long study. Some delimitations. The participants must begin the study before the age of 2. This is so I can get a full range of data on them. And the mothers must have had long-term use of meth rather than acute use. I don't want a mother who's been uses maybe once or twice in the last year. I want somebody who's been using it frequently, just so I can very clearly see the effects of the meth on the fetus. This study is going to be a longitudinal study. Like I said, I'd like to follow them from the time they're born to the time they turn 15, hopefully getting them to meet with me every year. So the independent variable is going to be prenatal meth use, whether or not they were exposed to meth as a fetus. This is going to affect my dependent variable, which is the mental and physical development. Some extraneous variables are going to be whether or not the mother is abusing other drugs. It's not something that I can control. Whether or not they're homeless, that can have a huge effect on physical and cognitive development as well as parenting style. So for my participants, I would like to recruit roughly 150 children, age 0 to 1. For the exposed group of children, the mother must have reported using meth consistently for longer than 1 month during their pregnancy. And then for the unexposed group, I'm going to require the mother to take drug tests just to exclude any other drugs affecting the results. For my procedure, I'm going to be using drug tests and medical records to find those meth-exposed patients. And to measure physical development, I'm going to be using the Tanner scale and the CDC milestone timeline. These are going to measure sexual maturity and just important milestones that happen along the time that they turn 0 to 15. And then for mental cognitive development, I'm going to be using the Strengths and Difficulties Questionnaire. This is going to measure hyperactivity, peer problems, behavioral problems, things like that. Then I hope to give out those questionnaires around the time of every birthday, from the time they are born to the time they turn 15. For my analysis, I'm going to be doing a paired sample t-test, and this is going to determine if there's a significant difference between the exposed participants in the control group. And then here are my references.